Have you ever felt short of breath and told yourself it was just age catching up with you? A patient of mine once shared that she would climb a few steps, pause to breathe, and whisper to herself, "Well, that's what happens when you're getting older." I want you to imagine this for a moment. You're taking a gentle walk, nothing strenuous, yet you feel a subtle tightness in your chest or a light cough that shows up only at night. It seems harmless, even ordinary, something you brush off because it feels like a natural part of aging. But what if those moments weren't aging at all? What if they were early asthma symptoms, quietly trying to get your attention? Many seniors confuse these signals with normal aging because asthma behaves differently way later in life. It tends to move slowly, whispering instead of shouting. Instead of dramatic wheezing, it often shows up as mild fatigue, shortness of breath during simple activities, or a persistent cough that never quite goes away. These symptoms blend so easily with the changes you expect as you grow older that most people dismiss them without a second thought. From my years caring for adults over 60, I've seen how often this misunderstanding delays treatment. By the time many patients come in, the inflammation in their airways has been simmering for years. Science shows that chronic airway irritation can progress quietly, creating long-term changes long before a noticeable asthma attack happens. That is why early awareness matters so much. Before we go deeper, I invite you to subscribe, like, and share Senior Health Daily. Your support helps us continue bringing clear, compassionate guidance to seniors across the country. As we move forward together, let my voice reassure you. You are not imagining these changes. You are not overreacting, and you are certainly not alone. In the next part, we will uncover the subtle asthma symptom older adults often overlook, and how recognizing them early can protect your lungs, your independence, and your peace of mind. Why asthma is often missed in seniors. Let's continue by exploring why asthma is so often overlooked in older adults. The truth is that asthma behaves very differently at 60 or 70 than it does at 20 or 30. Many seniors expect their bodies to slow down with age. They expect to lose stamina, to feel winded more easily, or to cough a little more when the weather turns cold. These expectations make it incredibly easy to mistake asthma symptoms for everyday aging. Unlike younger individuals who tend to experience dramatic wheezing or sudden attacks, older adults often experience a quieter, subtler version of asthma. Instead of obvious tightness in the chest, they may simply feel tired. Instead of loud wheezing, they may cough at night without connecting it to their lungs. Instead of struggling for air during exercise, they may notice mild breathlessness while doing daily activities like carrying groceries or climbing a short flight of stairs. These quiet symptoms overlap with many other conditions common in later life. Chronic sinus congestion, acid reflux, heart disease, low fitness levels, and even weight changes can blur the picture. Seniors often assume that the discomfort is predictable and harmless. They convince themselves that this is simply what getting older feels like. Because of this, asthma goes unrecognized far too often, and the inflammation inside the airways continues unnoticed. With age, the elasticity of the lungs naturally decreases. The airway walls stiffen. Mucus builds up more easily. These changes make asthma harder to detect because the lungs themselves no longer behave the same way they did earlier in life. When a senior loses breath quickly, they often feel embarrassed or frustrated rather than concerned. I have seen many patients dismiss their symptoms for years, believing their lungs are simply aging. By the time they seek help, the airway inflammation has progressed, making breathing far more challenging than it needed to be. Understanding this overlap between aging and asthma is empowering. When you know that fatigue and breathlessness are not always due to age, you begin to recognize your body's signals for what they truly are. You become more aware, more attentive, and more confident in advocating for your own health. Recognizing these subtle distinctions gives seniors the opportunity to protect their lungs before the condition becomes more advanced. Once this awareness begins, the path toward breathing easier becomes much clearer. Silent asthma signs. Older adults often ignore. There are certain signs that appear so gradually that seniors barely notice them at all. One of the most common is a nighttime cough. Many older adults wake up coughing when the air is cool or dry, especially during seasonal changes. They assume it is allergies, a cold, or simply the temperature of the room. They do not realize that nighttime coughing is one of the earliest and most important clues of airway inflammation. Another sign is breathlessness during very light activity. For example, walking from the living room to the kitchen or taking a few steps upstairs may leave someone unexpectedly winded. This is not the intense struggle for air that people associate with asthma, but rather a gentle feeling of running out of breath. Seniors often blame this on age, weight, or low stamina, not realizing that their lungs may be trying to communicate something deeper. A subtle heaviness in the chest is another overlooked sign. It is not painful. It does not feel like a heart attack. It feels more like someone gently pressing a hand on the chest. It may come and go, and because it lacks sharpness or urgency, people often ignore it. Fatigue is also a hidden clue. When the lungs are inflamed, even at low levels, the body has to work harder to get oxygen where it needs to go. Seniors may find themselves unusually tired or needing more rest than usual. Instead of recognizing this as a symptom connected to their breathing, they may assume it is part of the natural aging process. Science explains these symptoms clearly. As the airways become more sensitive with age, they respond more strongly to cold weather, smoke, dust, strong fragrances, and pollution. What once might have caused mild irritation can now trigger noticeable breathing difficulties. All these signs can appear one at a time or blend together so quietly that they go unnoticed. But together, they paint a powerful picture of early asthma that seniors often overlook, not because they are careless, but because the symptoms whisper instead of shout. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. Recognizing these signals early is one of the greatest gifts you can give your lungs. How asthma symptoms mimic aging. One of the reasons asthma remains hidden in later life is because its symptoms look almost identical to what many people expect from the aging process. A gradual decline in endurance, for example, is something many older adults accept without question. They might say they are slowing down, or simply not as strong as they once were. The idea that their lungs might be struggling rarely crosses their mind. Breathing changes triggered by weather also contribute to this confusion. When temperatures shift quickly or humidity drops, seniors often feel their chest tighten or their breathing become more shallow. They blame it on the cold air or their allergies, rarely considering asthma as a possibility. Yet the airways of older adults are far more reactive to changes in the environment, making these sensations important clues. Light wheezing is another symptom that goes unnoticed. It may happen only occasionally, or may be so faint that it blends into the background noise of daily life. Seniors often chalk it up to congestion, aging lungs, or an old cold that never fully went away. I once worked with a 72-year-old patient who believed for years that her breathlessness was a sign she was becoming less active. She would avoid stairs, walk more slowly, and rest more often. She felt embarrassed and told herself she was simply out of shape. When we finally evaluated her lung function, we discovered that her airways had been inflamed for a long time. With proper treatment and a few lifestyle adjustments, her breathing improved dramatically. She later told me she spent years feeling older than she actually was because she misunderstood her symptoms. Asthma can quietly reshape a person's daily routine long before they realize something is wrong. By learning how these symptoms mimic aging, seniors can reclaim a sense of control over their breathing and their quality of life. Real-life stories. The danger of misdiagnosis. Real stories reveal the impact of confusion between asthma and aging more clearly than anything else. One case that stays with me is a 68-year-old man who had been diagnosed with chronic bronchitis for several years. He had persistent coughing, breathlessness, and occasional wheezing. Despite multiple treatments, nothing improved. When he finally underwent a complete lung function assessment, we discovered he had asthma that had gone untreated for years. The chronic inflammation had significantly limited his lung capacity. Once he began targeted therapy, his health changed dramatically, but he often wondered how different things could have been if he had known earlier. Another memorable patient was a 75-year-old woman who always felt slightly winded in cold weather. She believed she was simply sensitive to the cold. One winter morning, she experienced a severe asthma episode that left her terrified and struggling to breathe. Emergency care helped her recover, but the experience changed her perspective entirely. She told me afterward that she had ignored the hints for so long because they never felt dangerous until the moment they were. Misdiagnosis or delayed diagnosis can lead to significant consequences. When inflammation builds slowly over the years, the airways become narrow and fragile. Seniors may find themselves in the hospital suddenly or facing long-term breathing difficulties that could have been prevented. These stories are reminders that understanding and acknowledging asthma symptoms early can spare so much fear, discomfort, and risk. Awareness is not just knowledge, it is protection, it is empowerment. And for many older adults, it is the difference between years of struggle and years of comfort. How doctors diagnose asthma. In older adults, diagnosing asthma in seniors requires a closer look than many people expect. The process begins with listening to the body's story. Medical professionals pay attention to recurring cough, breathlessness, nighttime awakenings, and reactions to environmental triggers. These clues help build a fuller picture of what might be happening inside the lungs. One of the most valuable tools is spirometry, a test that measures how much air a person can exhale and how quickly they can do it. This gives insight into the narrowing and inflammation of the airways. For older adults, spirometry can reveal patterns that may be mistaken for other conditions. Doctors may also assess how the lungs respond to gentle exercise. Some seniors only experience symptoms during physical activity, making this step especially important. Evaluating allergy history, exposure to dust or pets, and environmental conditions also guides the diagnosis. Diagnosing asthma in seniors is complex because symptoms overlap with heart disease, COPD, and other respiratory conditions. Many older adults live with multiple health concerns, each affecting the other. This means that diagnosing asthma is not just about identifying one issue, but understanding how several systems work together. When seniors understand how asthma is diagnosed, they feel more prepared, more confident, and more in control of their health journey. Everyday habits that help calm asthma symptoms. Daily choices have a powerful impact on asthma symptoms, especially for older adults. Simple adjustments can make breathing noticeably easier. One of the most helpful habits is maintaining a clean living environment. Reducing dust, mold, and pet dander in the bedroom allows the airways to rest at night, when breathing should be most peaceful. Keeping the airways warm during cold weather also prevents irritation. Even a lightweight scarf worn over the mouth and nose can soften cold air before it reaches the lungs. Breathing exercises are another valuable tool. Slow, deep breaths can relax the airways and improve lung capacity. When practiced regularly, these exercises help seniors regain a sense of comfort and control. Air purifiers designed to reduce dust and allergens can make a meaningful difference for people with sensitive airways. Many seniors notice fewer nighttime symptoms when they sleep in a cleaner air environment. Gentle exercise, such as walking, stretching, or chair yoga, supports overall lung function without overwhelming the body. Movement strengthens the respiratory muscles and boosts confidence. Medication remains important, and seniors should never reduce or skip treatments without guidance. Managing asthma is a partnership between daily habits and proper medical care. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. By embracing supportive habits and staying attentive to your environment, you give your lungs the stability they need. The hidden triggers seniors never suspect. Some triggers are so unexpected that older adults never connect them to asthma symptoms. Dust and mold from uncleaned air conditioners can irritate the airways. When these units run, they circulate particles that inflame sensitive lungs. Many people think they are reacting to the weather, when in reality, they are reacting to their home environment. Scented candles, perfumes, and cleaning products with strong odors can also provoke coughing or breathlessness. These items produce microscopic particles that irritate inflamed airways. Cold air is another powerful trigger. Stepping from a warm room into cold outdoor air can cause the airways to tighten instantly. This sudden shift often catches seniors by surprise. Acid reflux is an overlooked cause of nighttime asthma symptoms. When stomach acid rises into the esophagus, it can irritate the throat and trigger coughing. This connection is especially common in older adults and explains why some people experience nighttime discomfort without realizing the true source. Science tells us that aging airways are more reactive. While a younger person may breathe through these triggers without trouble, seniors may find themselves coughing, wheezing, or feeling breathless in response to even small changes. Understanding these hidden triggers transforms daily routines and helps seniors avoid unnecessary discomfort. What seniors can do to protect their lungs. Caring for the lungs becomes an act of self-respect in later life. The simplest step is to monitor symptoms regularly. Noticing how your breathing changes in different environments helps you understand what your lungs need. Talking to a healthcare professional when symptoms persist for more than 2 weeks is essential. Seniors sometimes delay appointments because they do not want to feel like a burden, but early conversations prevent bigger problems later on. Creating a living environment that is clean, warm, and free of irritants offers the lungs safe space to recover. Gentle daily movement boosts lung capacity and keeps the respiratory muscles strong. A nourishing diet supports the immune system and reduces inflammation. Foods rich in omega-3 fatty acids, leafy greens, and adequate hydration help the body respond more calmly to asthma triggers. Protecting your lungs is not about perfection. It is about consistency and listening to your body's needs. How long until improvements are noticeable? Many seniors wonder how quickly they will see changes once they begin adjusting their habits. Improvements often appear within 2 to 6 weeks. The first signs are usually easier breathing, fewer nighttime awakenings, and a gentle increase in energy. Some people notice that climbing stairs becomes less intimidating or that they no longer feel winded during simple tasks. Better sleep is another early sign of progress. When nighttime coughing diminishes, the body can rest more deeply, allowing healing to continue. Over time, reduced exposure to triggers decreases airway inflammation. As the airways become calmer, breathing becomes smoother and more comfortable. Healing is not always dramatic. It often happens quietly, one day at a time, until suddenly the changes become undeniable. When to see a doctor? Immediately, some symptoms require urgent attention. Difficulty breathing that worsens over minutes, rapid breathing or chest tightness that feels alarming should never be ignored. Persistent coughing with white or yellow mucus also needs evaluation. Signs of low oxygen, such as blue lips or extreme fatigue, are medical emergencies. Seniors should never assume these symptoms are simply part of aging. Early treatment protects lung function and prevents long-term complications. Seeking help is not a sign of weakness, but an act of wisdom and self-care. Remaining attentive to your body's signals ensures that you stay safe, supported, and empowered on your health journey. As we reach the end of our time together, I want to bring your focus back to something deeply important. Many of the symptoms you may have brushed off as simple aging can, in truth, be meaningful. Asthma symptoms your body has been trying to share with you. These signals are not signs of weakness. They are gentle reminders that your lungs still want to be heard and cared for. When you begin to recognize them for what they are, you open the door to better breathing, more energy, and a renewed sense of control over your health. I have seen again and again that the body remains remarkably resilient, even in our 60s, 70s, and beyond. Healing does not disappear with age. It simply responds more beautifully to patience, consistency, and awareness. When you offer your lungs compassion instead of judgment, when you choose understanding instead of dismissal, your body responds in ways that may surprise you. Thank you for spending this time with me and for trusting Senior Health Daily as part of your wellness journey. Your willingness to learn, to listen, and to care for yourself is a powerful act of strength. It shows that every stage of life still holds possibility and hope. As you move forward, remember that early attention to your breathing can give you many more years of independence, comfort, and ease. You deserve to feel safe in your own body. You deserve to breathe fully and live fully. If this video brought you clarity and comfort, I invite you to subscribe to Senior Health Daily so we can continue walking this wellness journey together.